Hi, in our last video we added a whole set of products, here they are, 29 of them in my case, using the product setup tab. But now what we need to do is give the promo planner a little bit more information about them. And to do that we have the product profile tab. There we are. Now you may notice I've missed out a tab in the middle, an orange one, the Customer Universe Setup tab. Now I've done that on purpose because for now I'm just covering those tabs that we need to provide the data for strategic level plans. We don't need customer data unless we're doing operational level or tactical level plans. So for the moment I'm going to miss out the Customer Universe Setup and go straight to the Product Profile Setup. Now, as you can see, the products that we have added have all come through automatically onto this table, and we have here 3 columns that we need to fill out. So let's take the first one first. It's type of therapy. Now what we have is a drop down, and in that drop down we have 4 choices. Now I'm sure I don't need to explain to you what chronic and acute means, but if you need to know that information, it's all written here under the what's required section, so please read that when you're ready to. So in my world, Pain-X is going to be a chronic product, so I'm going to pick that. There it is, it's a chronic product. I'm going to go on to the next product, Antifectum, and this, you'll be surprised to know by its name, is an anti-infective. And as it is an anti-infective, it's much more likely to be an acute product, so that's what I'm going to choose. Now Bofors, you might remember from my previous videos, well, that has a couple of indications, but I've chosen here not to include them as separate indications. I've just put a single Bofors entry here. So this makes it complicated for me because one of the indications is acute and one of the indications is chronic. So what do? Well, you need to use a little bit of discretion. If the business, the sales if you like, for Bofors is more or less 50-50 acute and chronic, then we have an option for that. You can choose it as acute and chronic. If there are 2 indications but one indication is very much more has very much more sales than the other, then you'll pick that. So if it's predominantly in acute sales you get, you'll pick acute. Let me get it right, there we go, acute. And if it's not, then you'll pick chronic. Now in my case I'm going to leave it as acute and chronic. So you get the idea. You just go down the list and tell the tool which it is, chronic, acute, or a bit of both. Now if one of these products that you've entered is not really a kind of pharmaceutical product, but perhaps more a device or I don't know, a syringe or a bandage or something like that, for which acute and chronic doesn't really apply, there is a 4th option which is unknown. In other words, nothing. So there you are. There are 4 options there under type of therapy, and we're asking you to choose which one is appropriate for each of your products. Next we have competitive pressure. Now let's get something straight here right from the very start. When we're asking about competitive pressure, we're not asking about the competitive nature of the market that you might be operating in. I'm sure every one of you from every one of your markets will tell us that you're operating in a very intense competitive market. What we're looking at here is to understand a little bit more about the specific markets of each of your products and how competitive they are. So to help you with this, if you look a little bit further down in the what's required section, I'll move down a little bit, here we go. There we go. You'll see that there is a definition for each of the drop-down options that you're about to see. We have very intense, high, average, low, and very low. And they are very specific definitions, and we need to try and keep to those definitions. So if I can move back to the top of the screen, if I'm looking at Pain-X and I open up the competitive pressure box, there we go, there are my options. Now in my world, Pain-X, well, it's in a very competitive situation. It's a generic. There are lots of other generics on the market here. It's for a pain therapy of which there are many choices. So definitely for my Pain-X product, competition is very intense. Now if you look back to our description here, that fits very well. Very intense. What does it mean? Well, it implies extraordinary competitive promotional activity, a very high promotional hurdle, possibly late entry into a well-established market, and there are many competitors, including generics. Now that fits very well with my view of what Pain-X is. So let's have a look at another example. Let's have a look at anti-infectum. Here we are. Well, anti-infectum is an anti-infective. It's an acute drug. It's not quite as competitive as other drugs might be in my market. I couldn't really describe it as very intense. So I'm more inclined to suggest it has an average competitive pressure. So I'll pick that there. Now let me check what that means. Average means, in our example, well, there's a mix of branded and generic competitors, and there's an average promotional activity, and that's pretty right for me. Anti-infectum, again, in my example, is a generic drug. It's competing with other drugs that are generic and some that are not. Average seems about right for me for what that is. So let's have a look at Bofors now. Well, Bofors, as you remember, has a couple of indications, and I have to kind of use my discretion and join those two things into one answer here, because I've chosen not to enter the indications separately. So what options have I got? Well, I'm not sure that very intense describes it. I'm not sure that average describes it. I've got some others down here which go on to the kind of low side where there are very few competitors or no competitors. I think for my Bofors, high sounds about right. So above average promotional activities being required. There are many competitor brands. Some are well established and some are generic. So let me pick high. There we go. So again, you get the idea. You go through each of your products and you make your best interpretation of what the competitive pressure is for each of them. Now, you might be thinking that there's an advantage to you if you were to make every one of your products very intense, but that's not really how it works. Let's think about this. If all of your products were in a very competitive market and you are therefore requiring to invest lots of money on promotion to keep the sales where they are or as you predict them to be, then that means our profitability is going to be relatively low. And ultimately, the promo planner and all these kinds of sales response systems are looking to optimize the long-term profitability of your portfolio. So if you are to mark all of your products as very intense, it might make it more difficult to invest in this market as perhaps another market where the competitive pressure is deemed to be that bit less. So there's really no advantage to you in telling the promo planner that every one of your products is in a very intense competitive situation. Instead, what we'd ask you to do is to try and keep as much as you can to those definitions that we provide here. Now we can look at the pharmacy substitution column. So what do we want to do here? Well, what we want to understand here is a little bit about what happens at the pharmacy. In most markets, a patient will have visited a doctor at the hospital or at a local clinic, and they've been given a prescription, let's say, and they will take that prescription to the pharmacy. Now, various things can happen with that pharmacy. And that's the kind of information we need to understand, and we need to understand that for each of your brands. So let's have a look at the choices that we're given. So there's a drop down, just as before, and we have three choices. Yes, very often, sometimes, and no. So what we're trying to understand here is that prescription that I have brought to my retail pharmacy, I've given it to my pharmacist, and on it it says Pain-X. Now, how often is it likely that the pharmacist will look at that and switch it to something else? If it happens very often, then we need to pick that option. If it happens occasionally, we can pick that option. If it never happens, well, we have an option to do that. Now, in my demonstration data here, Pain-X is in a very intensive competitive pressure. It's a chronic kind of therapy. So actually, it's very often the case that this product might be substituted. So I'm going to pick that option. So let's have a look at the next one, anti-infective. Well, that is an anti-infective. It's an acute therapy. It has a reasonable amount of competitive pressure. There's a few generics there for it. But because it's an anti-infective and it's very specific about the kind of infections that it treats, pharmacists are much less likely to want to substitute that one. So for that one, the answer here in my demonstration data set is definitely no. And for Bofors, well, Bofors has a couple of indications, and in both cases those indications are very specific, and whilst there is a bit of competitive pressure, it's quite a complex therapy area that we're trying to treat here. So again, the pharmacy is probably very unlikely to want to substitute a different brand in its place, so I'm going to pick no for that as well. So that's how it goes. We want to understand a little bit about what happens, or what generally happens, with the prescriptions that you get or the patient gets for each of these medicines. Now, I'm speaking to you from the UK, and in the UK, pharmacies are not allowed to substitute at all. They have to give exactly what's in the prescription. So in that case, it's going to be no for absolutely everything. But in your markets, very many different things can happen. So we're giving you all those options here. And that's it for the product profile tab. Now I'm going to fill in the rest of my table, but to make that easy for me, I have another Excel table here with all the details already filled in. So I'm going to simply cut and paste all of that information from there, and I'm going to place it directly here into my template. Now to do that, as you can see, I'm going to use the option to paste the values only because I don't want to upset all the formatting. So there I am. I'm going to pick paste values. There it goes, and now I have it completely filled in and all ready for the next videos. Thank you very much.